Getting referred to psychology does not mean your medical providers think that all of your problems are in your head. That is just objectively not true. I post a lot about different populations that I see, and the most traction I get is usually on my videos about FND, because the type of treatment approach I use is a rehabilitation type approach. And I've noticed a lot of people get quite angry in the comment section talking about how this approach causes harm or damage. And I've had a hard time thinking of how to navigate that, because I think it comes down to stigma that if psychology is involved in the treatment of something like, let's say, FND, then somehow that takes away the realness of that disorder. And so I wanted to share some additional populations that I work with where I use a very similar approach. I work a lot with brain injury populations. I specialized a little bit on internship and on fellowship in brain injury recovery and rehabilitation. And I've worked in inpatient rehabilitation units across all of my training. And I'll be blunt, the treatment we use for chronic pain, but also for post-orthopedic surgery, so acute pain, for spinal cord injury, for brain injury, a lot of inpatient rehabilitation will use a rehabilitation approach, right? Which basically means adapting to the things that maybe you can't do the same way anymore. So kind of compensating for any deficits that might have developed, but also trying to regain some of the losses that happened following that brain injury or following whatever, that orthopedic surgery. And I think it does just further stigmatize FND when people act as if it's psychology's fault that they're seeing a psychologist. The reality is I have so many families that can benefit from psychology because it is a complementary service in addition to your medical team, to your physical therapy team, to your psychiatry team. So I use very similar rehabilitation approaches for all of my patients, and all my patients are kids and teens, which means they're going to be getting the best possible care, because there are so many safety nets in the hospital system, typically, especially one as big and well known as one that I have the privilege of working in. So let's not stigmatize FND or chronic pain further by implying that just because psychology is involved, that means the team doesn't think there's anything wrong, quote unquote, with you.